Assalamu alaikum. I am Umar al-Hindi and I'm happy to have this opportunity to share this recently published clinical study with you. It is a retrospective clinical observational study published this month, May 2023, by the JOE. It's done by Plakwicz and his group from the University of Warsaw. They were showing an alternative way of dealing with mature closed apex canines planned for autotransplantation. The common treatment of roots and canals is in closed apex cases is to go immediately for root canal treatment after the transplantation or placing retrofill during the surgery followed by root canal treatment. Here they did 2 to 4 mm resection of the transplanted canines without placing a retrofill nor doing root canal treatment. They were aiming for revascularization. They included 5 patients in this study. They were all female young patients, age 12 to 14 years old at the surgery time. Their surgical protocol was extracting the fully impacted canines, resecting 2 to 4 mm from the apex, keeping the teeth in saline while preparing an artificial socket between the lateral incisors and the first premolar by round carbide burr. They located their made sockets too buccal to minimize the risk of damaging the adjacent roots. Then they planted the resected canines and made sure it was loosely fit in the artificial sockets to prevent pedal damages. Then they stabilized the teeth with sutures only. The auto-transplanted canines then aligned by orthoforces 2 to 10 months post-surgical or post-surgery into the planned positions. The minimum follow-up time was 2 years and the mean follow-up time was 4 years. Only one of the 5 transplanted canines showed external cervical resorption at 1 year follow-up. And they treated this canine surgically by removing the granulation tissue and placing G-restore. All the 5 canines responded to vitality test with normal limits and physiologic movement. No signs of ankylosis were noticed, hence all canines moved by ortho and CBCT showed a normal pedal space. All the transplanted canines showed progressive obliteration of the bulb space, which the author took it as a sign of successful revascularization. The obvious limitation of this study, as they mentioned, is the small sample size. They concluded that autotransplantation of mature canines can still maintain its vitality. My personal opinion, it would be an adding point if the author elaborated more regarding how they came to conclusion that this procedure and the obliteration did not affect the color of the teeth of the transplanted canines, and of course further studies with larger sample size and longer follow-up time is needed. Thank you so much.